Hey, what's going on, people? This is the Cornerstone Podcast. Subscribe, like, comment, and share the content. This is another installment of the series, What Do You Do? So you can follow us on YouTube, Stitcher, Spotify, Google Podcasts, and iTunes. So it is my pleasure to welcome to the platform for the second time out of Philly, Dr. Natasha Jacques. How you doing?
I'm doing well. Oh, like a round of applause
Yes,
even.
a round of applause.
I
Yeah.
am doing well.
Now, how's your holidays going?
Good. As you remember, like my mom and I take that annual trip, right? And so we did it this year. It was, um, it started the weekend after Thanksgiving, so like that Saturday, and went for the first week of December. So we went to Mexico, Cabo. So on the west side, we usually go on the east, kind of south, like those states where it's like the ruins and the cenotes and things like that. But this time we went to Cabo, and it was gorgeous, and it was
Hmm.
paradise, and it gave me this little glimpse of what retirement could look like.
Oh, nice. I went to
Mhm.
Cabo in 2018 for a wedding. I was the best man of it, and had a good time. It was cool. Played some golf. Did a lot of fishing, so it was a nice weekend.
Yeah, for
Yeah.
sure. Like of all the places that we've been to in Mexico, this one felt the most like American, like the kind of downtown city. It had all of these different activities that were just geared towards like city living. It felt less of like excursion, like a Caribbean excursion, more just like a hotter part of the US.
Yeah, I felt that Cabo wasn't really Mexico like. It was more like Arizona or New Mexico.
Right.
But yeah,
Right, right, right.
it didn't feel like Mexico at all. But still,
Mm-mm.
it's still fine though. I mean, you're still
Beautiful.
right out the Pacific. I mean, the
Yeah.
water was beautiful, but where we were at, the I guess the waves were like so strong you couldn't really get inside the water. Otherwise, that current would just pull you into it. So yeah,
Mhm.
they actually warned us to not even approach the water at all. But it was
Yes.
nice and
Yeah.
pretty, but you just can't really go into it.
No swimming, yeah. We stayed in Cabo was, like, near, the Sea of Cortez, and so I think that area is, like, calmer waters, and so there were people swimming, and actually, I don't even recall seeing a lifeguard, so people were obviously responsible. Um, but it was really, really beautiful. Just, like, being able to walk into the ocean and still see your feet even though you're, like, neck deep in something, you know? Just
Hmm.
something you do not get on the Atlantic coast at all.
Yeah, I feel the same way, Lake Michigan. So yeah, the
Mhm.
water,
Ugh.
like from afar, like the water is nice, but once you get up close and personal with it, it was like, I don't, I'm not sure if I want to get in that water.
Absolutely. You're like, "What's in here? Who's in
Mhm.
here?"
Yeah, yeah. And like you and your mom, y'all do these trips like every year. Like, how long y'all been doing this for?
We started the year I graduated undergrad, so we're looking at like 2007, 2008, I think was our first one. We've only skipped 2 years, and one was because of the passing of my grandmother, which was my mother's mother. And then the other one was pandemic. We were supposed to go, actually we didn't even have any place to go because the pandemic started in March, and we usually do
Mhm.
this December, so we didn't have anywhere in mind. But yeah, only those two times, and it's always around the holidays, like Thanksgiving, between Thanksgiving and Christmas.
Oh, that's awesome, man. I just happened to kind of catch you at the very exact location
Yeah.
time. So it's by
Yeah,
chance. It's so crazy.
for
So yeah,
sure.
yeah, like yeah, 2010, Hawaii, Waikiki
Hmm.
Beach. So yeah, it was
Hmm.
cool. So yeah,
Yeah.
so,
I
yeah.
actually recently, it had to be around this time, like like obviously this time of the year, but I think it was like actually around this week because I was getting, those memories from Google Photos of like this time 10 years ago, and it was like pictures from the Hawaii trip, and like the what was it? Wasn't it like a roast, not a roast. What do they call those with
The
the
luau.
luau? Yeah, it was like the luau, and like my mom and I, we went to, I forget what volcano it was, but like pictures from that and stuff like that. So it had to have been like last week at some point.
Yeah, I was out there for my 30th birthday, and I just turned 41 yesterday.
Happy birthday!
Oh, thank you so
Oh
much.
my gosh, congrats. I love birthdays. Happy birthday.
I don't speak for all men, but for I guess usually men really don't treat their birthdays
I'm
just
realizing
as
that.
extravagant thing, but
I'm realizing that. And
my
apparently
birthday
it's
is just
not
another day. So
the status quo to give like your buddies gifts. I asked someone, and it was just like, "Oh, what do you?" Because they said they were going to a birthday party like this weekend, and I was like, "Oh, what are you getting your friend?" And you were like, my presence. Like I'm actually going and I will be there in attendance of his birthday party. Isn't that sufficient? I was like,
Uh,
is it? Like it doesn't seem
that's
enough,
hilarious.
but okay.
Oh, okay. All right. Well, let's get right to it now. Like in our first video, you kind of touched on some aspects of your profession. So like tell the people for like the second time, what do you actually do?
I do a lot. I think I do too much. So I've broken it down to what I call insurance paying job and the other jobs.
Mhm,
The other two jobs are part time, obviously. But my insurance paying job is working for a healthcare system that services specifically a specific population, veterans to be exact. And I work in mental health, of course, but I work in a subsect of mental health that is located within the primary care setting. So I'm like right next door to primary care providers. The intention behind that is that mental health and physical wellness is so intermingled, but yet there's still this stigma around getting mental health services,
mhm,
especially for a veteran population. And so think this I mean this our program has been around for a while, and now it's like nationally mandated for all of the hospitals to have this particular program. um, but the idea is that if you can minimize or eliminate the stigma around seeking mental health services if it's literally right next door, as opposed to your primary care provider having to give you a referral to go to a different floor or a different building that has this name of being the mental health clinic. So why not just
mhm,
see a coworker that just works next door, to talk about some of the concerns that you're having, and that varies wildly from you know, changes in your mood, anxiety, trauma based symptoms, substance uses, to even behavioral concerns. Like, I want to improve my physical health. Like, sleep is an issue for me. What do I do for that? I want to start working out. Like, how do I make those habits? I want to stop smoking. How do I make that happen? So,
mhm,
thankfully, we do get to service and we get to see a number of different people in a wide range of where they are in terms of motivation of change, or even like symptom severity, like how bad things or how distressing things are for them. So that's my insurance paying job. That's the one I do 40 hours a week.
mhm,
The other job that I have is an adjunct lecturer for a university. So I teach master's level social workers, or students who are in a graduate program for social work. I teach
mhm,
them or I lead classes specific to sexuality in some way. So human sexuality, or clinical practices like therapy practices with LGBTQIA individuals, couples. And then my last gig is providing supervisory hours for social workers who are looking to sit for their clinical license. So, for social workers, once you graduate with your MSW, you can immediately take your licensure exam. Like right after graduation, like the day after graduation, I think even like weeks before you graduate too. And then once you complete that, at least in the state of Pennsylvania, you will get an LSW and you would be a licensed social worker.
mhm,
You could start seeing clients, you can start doing advocacy, you could do a lot of stuff with that license. But for social workers who are interested exclusively in therapy and want to go that extra step, they have to get 2 years of supervised clinical hours. And so I'm providing those supervisory hours for them. So those individuals at the end of our 2 year mark will be able to sit for their LCSW, which is licensed clinic social worker. Both of them, LSW and LCSW, requires a test. You have to study for it, obviously, and then it has to be maintained. So every 2 years in Philadelphia, or in Pennsylvania, on our odd years, we have to re not like resubmit for our license, but we have to do continuing education within those 2 years to stay up to date with things, and then present that to the licensure board to say that we are current and we are up to date with our stuff. Please relicense me for the next 2 years.
oh, awesome. Okay.
Hmm.
Now, in regards to your 40-hour week job, how much is it that deals with with sexuality as far as the mental health part? I mean, is it like a small portion or is it a majority portion of it?
So it is, I would say about like 25% of my cases. And so within that work, I lead a class specific to men, or specifically for men, I should say, about sexual health and wellness. And so within that class, it's like, it's not really like, get tested or quizzed or anything, but it is predominantly education. I'm providing education on a particular topic, and within that class we talk about sexual functioning concerns like low desire, low sex drive. We talk about ed, erectile dysfunction. We talk about what could be contributing to those things, like what's happening in your body that could be playing a role. Is it some of the medications that you're taking? Is it like family stress or environmental stressors? Is it, untreated depression, anxiety, PTSD?
Mhm.
And then we also talk about like what treatment is available to help. So there are things that medicine can do for sure, but there are definitely things that we can do on our own to see a positive change in this area of life. For some people, it could be even as um, minimal of a or less invasive of a change as like stop smoking, or reducing your alcohol use, or is it
You know what?
like
I gotta stop smoking myself, but this is a
you
vape.
should stop smoking. Everybody should stop smoking. It's pretty bad. It's pretty insidious. Or is it that you're experiencing ED because of untreated depression and untreated anxiety? So maybe we connect you with a mental health therapist, and you treat the depression to be able to see kind of like a rolling side effect of being able to treat the ED. So I do that. I also see patients, clients, one-on-one for specific sexual health and wellness services. So again, that's a little bit more dynamic. We're getting a little bit nuanced into the individual, as opposed to kind of a general education, but really taking into account what's happening in your life,
Mhm.
what's going on, what's contributing, and then again working with them or potentially working with them and their partners, on how to alleviate the distress that this sexual functioning concern is happening or is causing, I should say. So I
Now,
would
as
say
far
about like
as
25% of my cases.
okay, so as far as you providing that service for men, is there like a mental roadblock for men to kind of like be open about their sexual deficiencies, like to like
Mm.
women?
To their partners or to me as a female therapist?
To you as a female therapist.
No, I haven't had anybody, be like, I don't want you to be my therapist because you're a woman. I've never had anybody say that. I honestly think that for on the mental health provider side, it really becomes my own attitudes and biases and beliefs about this, right? If I'm walking into a session with a client and it's the first one, if I'm like a little bit coy and shy and trying to like skirt around assessing this, people are going to pick up on that. That's like energy. So people are going to be like, well, she's freaked out or she's uncomfortable with this. Like, why would I want to talk to her about it? Um,
Mhm.
and this is something that I share with my other colleagues who don't necessarily do this kind of work majority of their time, is that like this is a part of health generally, like it's just a part of our life throughout various stages of our lifetime. We are sexual beings, um and this is a valued and important aspect of our health. So if you are going to assess for this, which you should, I really do think that every care provider, regardless of the type of care, like primary care should be assessing this, mental health of course, but urology, pulmonology, like oncology, all of those people should be assessing for this. But if you go into this even with the aura or the framework that this is just another thing that I'm assessing for. This is just like I would assess for suicidality. This is just like I would assess for, distress in the family. This is just something else that needs to be covered because it can greatly impact you as a person, like how you see yourself. It can impact your relationship if you are in a relationship. It can even impact or limit you from engaging in relationships. Like I've had a number of the men that I work with that like actively avoid romantic relationships because they don't want to have to talk to their partner about why this particular area of their life isn't functioning the way that they want to. And how distressing is that? Like you could potentially be dating somebody and getting that intimacy and you're actively avoiding it because you don't want to talk to that potential partner about your ED or your low desire, whatever it is. So
Mm.
I haven't had anybody say no to me, but I also wonder if it's because I don't have a problem talking about it. And so I give off that energy of like, this is just something that we need to cover.
And what age does ED usually start to occur?
Hmm. We know there's a correlation with age. It could happen to anybody throughout the lifespan. But we know that there is a relationship, there's a correlation, a positive correlation that, the frequency of this happening is more likely as an individual gets older. And that
Hmm.
could be for a number of things. But like diagnosable, but it can happen spontaneously and, not chronic for a lot of people for a lot of different reasons, right? Like, if people are nervous, they might have trouble getting or maintaining erection. If people are experiencing like literal chronic health issues like untreated diabetes or cardiovascular issues, they can have ED, and it's likely that they might experience ED as a result of that. So it's not
Now,
to be
is
like
ED more mental or like a physical deficiency?
both. And if you, not you, but like if somebody is experiencing ED, I do think that the first step is to talk to your primary care provider about this. Like, this is
Yeah.
something that's happening. They can do a lot of things to help kind of that initial assessment. They can, potentially run labs, metabolic labs, just to see if your systems are doing what it's supposed to be doing. um I do think on the level of the patient or the client, you should come with some data. So not like I'm experiencing ED, but even coming with some more precise data of like, I've been experiencing ED for the last 6 months. This is unusual for me. It's happening 50% of the time that I go to engage in sexual, activity, or it's happening 100% of the time. Even if it's situational, it only happens with this partner, but not with this partner. It only happens with partners as opposed to when I masturbate, right? So giving your provider all of that data so they can make an informed assessment or make an informed prognosis about what's going on. And so oftentimes, primary care will use kind of masturbation or even like initial like morning erections as an indication if this is physiological or if this is kind of psychogenic. Is this related to something in your body not doing what it's supposed to be doing, or is this related to mental wellness or mental health in some way?
Okay. Well, I'm not sure if you ever seen this meme, but I thought it was so hilarious. It's basically about this elder gentleman. I think he was maybe in his 50s or 60s, right?
Hmm.
So he went to his healthcare provider and asked them to watch him have sex because he thinks that he was kind of doing things wrong.
Mm.
So the reason why he wanted them to watch him have sex is because he could get that bill through his insurance instead of going to a hotel because he was cheating on his wife. So he was having sex in front of the healthcare provider with his mistress so that he can get it billed instead of paying for an expensive
So
hotel.
he has like an excuse, like, no, honey, I'm going to the doctor. I have a
Yeah.
doctor's appointment. Not
Yeah. So is
I'm
it true
eating.
that healthcare providers can actually watch you have sex just to kind of see if there's anything going on
No.
that you're doing
I
wrong?
I don't know any healthcare provider that would do that. That was a lie. That meme
Well, that
is
was
a
a
whole
meme, so
lie. No, I don't know any primary care, even if I had a patient come to me and they were like, "Well, can you just watch me masturbate to see if I'm doing it correctly?" I'm like, "Mm-mm, that's not
that's not your job description.
no, no, that's not what we're doing, at all." But you can verbally describe what you think is going wrong or what you are finding to be distressing about your practices. But uh-uh.
Mhm.
Mm.
Oh, okay. I was just wondering because I saw this meme,
Yeah,
like,
that's
recently,
weird.
so, yeah, I was just wondering if y'all even provided that service, but yeah, but anyway, I'll go with the first actual topic, so, I
I
mean, you
do
had
think I'd
said
probably get
earlier.
my license taken away if that was the
Oh,
case.
yeah?
Yeah,
Oh,
yeah. I
yeah?
think most
Okay.
healthcare providers, that would be a violation of our code of ethics for sure.
Oh, okay. Oh, well, hey, makes sense, so, makes sense. Now you had mentioned earlier about how obviously sex is like a normal part of biology. I mean, it's
Yeah.
common, but unfortunately, sex gets a lot of men in trouble, especially.
Hmm.
So, So as far as my first topic, as far as is sex addiction, is it really real? Like, is it a
Mhm.
legitimate diagnosis? Is because let's use Tiger Woods as an avatar, right?
Okay.
Remember back back in 2009, it was found out he was cheating on his wife with some cocktail waitresses from like Hooters and some bar and grill. So
Mhm.
I mean, like most men probably would have thought that, okay, Tiger Woods. I mean, he's Tiger Woods, so he has opulence, opportunity, and options. So of course, someone like Tiger Woods would be going through that because everywhere he goes, he is highly desired. My
Mhm.
whole thing was that as far as him doing that perp walk through the media, talking about he has sex addiction, I just thought that he was using it as an excuse. So is it really real? Like, if you
Yeah.
can explain that.
So the kind of mental health field is very split on this. So it is not a something that can be diagnosed. So mental health works off of a diagnostic manual. We call it the DSM,
Hmm.
literally diagnostic to statistical manual, and it provides a list of what are considered mental health or behavioral health or cognitive deficiencies or concerns, and it has specific criterias of what meets or what constitutes a symptom of like depression or PTSD, post traumatic stress disorder, for example.
Yeah.
So no, sex addiction is not in the DSM at all.
Oh, interesting. Okay.
It is not in the DSM. Additionally, ASECT. ASECT is the American Association of Sexuality Educators, Counselors, and Therapists. So if somebody wants to be like a certified sex therapist or a certified sex educator, this is the kind of the governing body that would kind of sanction or back that certificate, if you will. And so they're kind of very much considered, especially within our country, very much considered the go-to people, if you will, of updated or up to date knowledge information about sex and sexuality. And they too, and I think this was around in 2016 that they put this out. They too have taken the position that they don't find that there is sufficient research. It's like empirical evidence, but there's not sufficient research to support that sex addiction or porn addiction is a mental health disorder. So they too haven't really backed it. However, if you talk to, therapists that are doing the work, they're kind of in the trenches working with people, clients who have come to them for a sex addiction, they will have a very different kind of attitude towards it. Some might actually think it is worthy of being in the DSM, which comes with some benefits, right? If it's in the DSM, if it's recognized as a, mental health disorder, that means that you can bill for it. If you can bill for it, that means you can get reimbursed, right? That means that the client actually might not have to come out of their pocket to pay for this treatment
Hmm.
because it is seen by health insurances as, a valid diagnosis.
All right.
So there are some, like I said, it's kind of split, but generally there's like not enough research on sex addictions, and even less about like treatments for specifics, like specifically for sex addictions. And what we do have in the literature and the research isn't showing any kind of pointing exclusively to something that's reliable and valid. It's very variable, like the research outcomes. And so that's not to say that somebody can't have kind of impulsive or compulsive behaviors around sexuality or sex. Um, and it could mean a number of different things, right? Like it could be that they are coping with something else in their life, and this is how they're coping with it, as opposed to like the sex actually being the problem. Um, the other thing that I wanted to mention about that is that it can, even now, like not now, but throughout history, like sex addiction, this isn't like a new thing. Like medicine and therapy has always had a name for it. Like kind of ancient and retired names are nymphomania,
Yeah.
right? A woman
Hmm.
who is like, has an overly aggressive sexual appetite. Or even the male version, which is Sartorius. like, but this is the male version of it. So like
Right.
these terms are old, archaic. They don't really, you don't really actually hear medicine talking about it. But that's, I'm bringing it up to say that like this isn't new. Like people have always expressed or seen or shown indications of kind of like impulsive sex behaviors or hypersexuality. You might hear people use now hypersexuality. So really gets to shift over time and influenced by society, right? Influenced by culturally how we're viewing this or seeing this, how society kind of like maybe demonizes it or praises it, stigmatizes it. So there's a lot of fluctuation with that. um in terms of care, so if somebody were to go to a mental health provider and they were like, I think I have a sex addiction. The mental health provider would be doing a lot of assessment to actually determine like what's going on here. Um, and you're looking at it from a mental health perspective. You're looking at it like with any other addiction. Is there like an increase in behavior to get, like if somebody continues chasing, what is that terminology specifically with drugs, like chasing the
Pitching the
chase
high.
yeah, like chasing a high. Like are you consistently like edging or increasing frequencies or types of behaviors to get that initial high? Are you negatively, like not negatively, but are you um are other parts of your life being directly impacted? Like, for example, like, are you not going to work because you have to go find, a sex worker, even though you have a partner? In addition to your partner, you need to find a sex worker, and maybe this other thing. Are you like draining your bank account to be able to feed this, particular addiction,
I mean,
or
men drain their bank accounts without a sex addiction towards women.
right? So but those are the things that you would look for, right? In terms of like what is kind of compulsive or impulsive behavior. Are you doing things that are contrary to your like survival in order to meet this particular need?
Now, okay, so what is the magic number as far as the occurrence of sexual partners in order to be qualified to have an addiction?
That is quite subjective. There is no magic number. I went to a conference like, what was it, 20, I was looking at the name tag, like 2012. I went to a conference, and in that conference there was a speaker who, and I love this so much, I keep it, I share it with my students. She had said that promiscuity is defined in the therapy session. Promiscuity is defined as one sexual partner more than your therapist, which just highlights how subjective this is, right? Like if you talk to somebody and they're like, what's your number? Or like, as the children say, what's your body count? If
Mhm.
you were like, oh, it's really high, it's about 5 people, but that person has had, 10 sexual partners, and be like, in comparison to their life, right? Not that high. Or maybe you talk to somebody and they're like, oh, well, it's been 50. And that person who had 20 or 10 were like, oh, that's a little bit higher than me. So it very much is this kind of comparison thing. So there is no magic number to indicate what is, promiscuity or what constitutes, being a sex addiction. So it's really not about the number. It's again the things that you are doing to feed that need that is causing distress in your life. And that's also subjective, right? Because if you're out here, being a quabillionaire and you have access to all of the money in the world, it probably means nothing for you to drop, $10,000 for an encounter with a sex worker. Whereas somebody who's in middle class America, that's going to be a lot of money, right? So it's very, very subjective. And the distress level is also to something to keep important. How distressed is this person by this particular behavior? Or having to engage in this behavior. Some people be like, "No, it's good. Like I appreciate I'm okay with having 5 sex partners a day. I'm being safe, I'm being careful, everybody is like in it and to win it." And other people will be like, "No, I don't want to engage in this behavior. It's hard for me to stop doing this."
So are you in the yay or nay of it actually being a legitimate, um, you know,
Yeah.
mental disorder, whatever?
Yeah, that's really hard for me because I'm part of that camp of like I'd like to see more numbers about this. Like I'd like to see more research about this. I'd like to see more conclusive information about how we're going to effectively treat this that we know that works. Right now, the current kind of go-to modality is based off of the 12-step program, which 12-step program has like a foundation of like religion, right? And like a moral coding. So for a lot of people that doesn't jive with them because they just don't ascribe to religion or to a god, right? And
Mhm.
so if that's the go-to treatment at this time, and there's nothing to say that this is like an effective treatment, it's a cure all, but if that's what I have available to me, but I don't like associate like god in my healthcare or god in my treatment, like what is available to me. So I do hope that there is going to be more of a motivation or more of a push to do research in this area because people do suffer with some kind of impulsive sexual behaviors, and that's very, very real and distressing, like I said, to the folks that are experiencing it. Um, but what can we do as healthcare providers to kind of like systematically make sure that we're making a positive change using treatment that we know that works, not like me as your therapist being like, I heard from a friend that moon rocks are going to be really effective at treating this. So you just need to, rub a moon rock in your hand 3 times a day and this should be good. You're like,
Hmm.
what is that backed by? Like, where did you get that information? Right. So
Right.
we definitely want to be delivering care, delivering treatment that is backed by research to indicate that, yes, this works, this is reliable, and it works to treat what it's supposed to be treating. It is valid.
Okay. I just find it kind of ironic that only celebrities seem to kind of claim that they got sex addiction. So, like the most notable ones are Tiger Woods, Charlie Sheen, and Michael Douglas. But these are
Yeah.
rich men. So,
Yeah.
obviously,
Rich
I
people
mean,
problems, maybe.
oh yeah, I mean this is a first world problem to have anyway. So, but yeah,
Mhm.
I just thought it
Mhm.
was kind of ironic. All right,
No, it is
next one.
interesting for sure.
Oh yeah, yeah, most definitely. Now the next one, California banned stealthing. I thought
Mhm.
this was kind of like a no-brainer because I mean, I think every state should have this law as far as, if you're deceiving your partner into
Mhm.
believing that you're actually using a condom that you really not, and then
Mhm.
right, she never consented to that. So I thought it was a no-brainer, but for some reason, I think California was like one of the first states to pass that,
I
right?
think they're the only ones at this point.
Only one? Okay.
Yeah.
Okay. Yeah.
And like the US consistently tends to be behind the times as it gets to like sexuality and reproduction and things like that. Like other countries have this as like sexual assault, like actually defined as sexual assault. I think California's is not like defined under sexual assault. Like it's not a criminal charge. I think it's something that it's like a civil one. So you could sue somebody for it as opposed to going to trial to sentence them to, years in prison. Um which can be
Oh,
really
I
so
didn't even know that.
yeah, so to define it, stealthing, like you said, is like, going into a sexual act and at some point removing the contraceptive, like would that be a condom, but removing the contraceptive without your partner's acknowledgement, knowledge, consent, if you will. Um, which
Now, does it work the other way though, as far as a man believing that the woman's on birth control? Now, would that be considered
oh,
also?
so no, so this particular the stealthing is specific definition of like removing a condom.
Okay.
Mhm. And California, like I said, I think is the only one that only of the states that has it on its books, and it's something that can be brought up in civil court as opposed to like criminal court. Um, which is helpful, right? For a number of reasons. With civil lawsuits, the individual can make the decision that they want to move forward with this as like suing somebody, as
Mhm.
opposed to a criminal offense, right? Like if I'm the victim of a crime, it's the city deciding to actually press charges against the alleged perpetrator. I
Mhm.
might not ever decide. I might actually be like, and SVU has shown us a number of these cases, right? The person's like, no, no, I don't want to press charges, and like the ADA is like, too bad, like we are pressing charges against this person. So there is like a level of not ownership, but an ability to kind of make your own decision as opposed to these things happening around you as a person who's submitting this suing file. I'm not really sure with like legal terms, but who is going forward with suing the person. So there's that. Um, and also less likely to take as much time as a criminal court would take, right? Like criminal trials, we know from recent examples of what's happened in our culture, are not that speedy. They take years, if you will, to actually get to court. And then you still have to wait months for sentencing. Like I didn't realize that the um the individuals for um there was just like a recent sentencing that happened for George Floyd, and I was just like, I thought the sentencing happened like a minute ago. Like I didn't realize like we just got the um, sentencing trial for that one.
I
Um,
believe he changed his plea,
mhm.
recently, right?
I I'm not sure about that, but I know the sentencing I think was like 22 or 25 years or something like that he got for that.
Yeah, and as far as some change in his plea to a guilty plea, I guess it's supposed to
Mm,
possibly reduce his overall sentence. So I'm not sure about that, but I just
yeah.
read like a headline that he was planning on changing his plea. So I just thought it was interesting.
Yeah. But again, George Floyd happened in the pandemic, right? That was like May, June of the pandemic?
Yeah, yeah, and it started the summer of last year. Yeah,
And then the trial happened like late this summer, so that's a whole year and change. And then
yeah.
sentencing just happened, so like at least a year and a half, right? So I believe like civil lawsuits are just a little bit quicker than that. Not to say it's going to happen tomorrow, but they move a little bit quicker than that. um and then oftentimes, like I was reading some articles that were stating that, especially with stealthing, the kind of victim, if you will, might not want to like for this person to experience jail time, but maybe just wants some compensation for, the byproduct of this stealthing, right? Like maybe it resulted in an STI or an STD, and they're like, well, now I have to get treatment specifically for this, and maybe I don't have access to healthcare, and where am I going to get this money for that? Or it could even, result in wanting to get care from a mental health provider because of whatever, trauma related symptoms that can be occurring, and they're like, I just want this treatment to get paid.
Mhm.
So I think it really does help the individual in a few ways. But I agree with you. It was it was interesting that this made such headlines because it's justified, and it should, right? But it also, like you're saying, it really like puts a spotlight on the fact that this particular state is unique in this way, that other states haven't don't constitute this as a violation of somebody's rights in some way.
Yeah, prior to them making it an actual law, I actually heard of the actual term stealth for like
Mhm.
years. So I
Mhm.
assumed that every state has some type of
No,
legislation about it
no,
or law. So
no. Sad. Some
naive, I
states, some states actually have, I don't know how many, but I do know that there are, where I'm going with this is kind of like the absurdity with like, especially as it relates to like sexuality in the law. But like some states still allow like children brides. Um so we know that engaging any sort of sexual act with a child is illegal criminally. You can go to court and spend a lot of time in jail for those acts,
the first
regardless.
2 states that come to mind, I may be I may be out of line, but maybe Mississippi and Utah. So
Yeah,
I
so I
could be
don't know. And I don't know how many states, but I do know that there are some US states that still have this, that like, even though we know that, right? Like, somebody is not of the age of consent, and so they can't agree to any sort of sexual activity. If you engage in sexual acts with this person, you are going to get arrested and tried for those crimes. However, there are some states that have this kind of, what I think is like a loophole, that if the parents give permission for this child to marry this adult person, then it's fine. And I'm like, how does that make sense? How does that make sense? So
I
yeah, some
mean,
absurdities.
it happened about 100, well, maybe not that long. I would say maybe I mean, it was quite common in the South, like, prior to the, Civil Rights Act. I mean,
Oh,
young
for sure.
people
Yeah.
getting very young,
Age of consent is like a newer kind of
yeah, it's
phenomenon,
very
right?
new, yes,
Um,
exactly.
which brings us back to what we were talking about with the sex addiction, right? It really, a lot of this is fed by and informed by kind of societal norms at that time, right? Like, also, when did it actually become illegal to, incest? Like, incest wasn't always illegal. Like, we know, like, royalty, right? Oh, like, from way back when, would always, quote unquote, keep it in the family to make sure that royal blood was, like, safe. But more recently in our time frame, our society, our zeitgeist, if you will, it's illegal, and also just kind of viewed by with kind of a, judgment and disgust, right? So these all very much become, you know indications of where we are in society in that moment in time, and culturally dependent, right? Like, we could go to a different country and they're like, that's fine, that person is 15 or whatever the age might be.
Yeah, yeah, yeah. The West, yeah, we're. I mean, you know what? We are so sexually liberated, but the age of consent is like at like a certain time period, like 16 or 17. I mean, is some states 18
It
or
varies. That's also, like,
or the
variable with
federal
state by
statute?
state.
I believe the federal statute may be 16 though, right?
i, I don't know.
Not sure. Okay.
I don't know.
Okay.
But also, like, even that, whatever that clause is, that's like, if you're within a certain age group, that you wouldn't be tried, like, you wouldn't be, arrested for this, like, that's variable by state by state. I
Like,
think
cause
it
they
used
go
to
to
be
the
called, like,
same
the
high
Romeo and
school or
Juliet.
something
Yeah,
like
yeah,
that.
yeah.
Yeah. Yeah.
Right. Which again just shows you, like, this isn't a universal thing. If, like, Pennsylvania's doing one thing, but, like, Wisconsin's doing another thing, like, it's very, very subjective to the people, to the time, and to the place.
Yeah. Okay. Well, that kind of goes into our next topic. Now, Texas, they ban abortions at 6 weeks, in which Roe v. Wade is pretty much in the news right now because I believe the Supreme Court is currently hearing some cases on it or something like that, and they
Mhm.
may just overturn it in general, and then like 12 states may well, they had trickle laws in which as soon as Roe v. Wade is shot down, then those states are automatically going to get rid of abortion.
Mhm.
So what's your thoughts on that?
Me personally, I'm like, I think that's terrible. I think it would be, several steps back for us as a country to basically send the message that an individual can't make decisions about their healthcare in general. What comes to mind for me, especially, is the kind of institutionalization of, like, women, right? Like, I don't know, back in, like, the 30s or 40s, if your wife was acting up, you can institutionalize her. You can say, like, she's crazy, and then she could be institutionalized against her will, right?
Right.
We also know that, like, sexual minorities were institutionalized, right? Because sexual minorities being, members of the LGBTQIA community, that those individuals were institutionalized because of their orientation. Even the DSM that I had mentioned, had listed, homosexuality as a mental disorder until, like, its third edition, which I think was, like, in the 70s.
Mhm.
Um, right? So, like, it feels like I might be making an over exaggeration, but for me, it feels very much like a slippery slope, that if we start here and send the message nationally that people do not have agency over their own health treatments, that things can be done to you or done onto you regardless of what you want in terms of care, it can become extremely dangerous for us as a country.
Right.
Um, as somebody who has a uterus, like, it's just personally scary, that somebody else might be able to dictate how I decide to operate in the world. Um, and there's always this discussion, that even this is overturned, or even if this becomes illegal, that it doesn't actually stop abortions, right? That we just stop safe healthcare. um the behaviors will continue, the need for why people, the many reasons why people, access, abortion, this particular medical procedure, will always continue to be there. And so if we take away people's, like, safe way of doing things, right, by informed healthcare providers who are trained in this, we're just going to go back into I'm reminded of, what was it, Dirty Dancing, right? Like there was a scene where one of the friends got in a kind of like a back alley abortion, right? Like it's not going to stop it. We're just going to make it unsafe for people to
Mhm.
engage in to get this particular medical procedure.
Now, I don't want to feel like I'm mansplaining, but
Okay.
the way that I pretty much kind of like interpreting what's going on in these different states and in Congress, or whatever. But as far as them probably thinking that okay, sexual freedom is kind of run amok, so we got to take it upon ourselves to like be very strict on these abortion laws because fertility and birth rates are very low. So we need to make sure that we need to have create more babies because women are constantly aborting these babies. So like, do you think that's a legitimate reason for them to even doing what they're doing, or just let people just like do them?
Well, one, we're definitely not sexually liberated in this country. For sure. I mean, we've made positive steps, right? But like there's still a stigma about a lot of sexual behaviors. Like, you know, for example, there's very much this kind of like stigma of like men engaging in anal sex, like actually being the one that's getting anally penetrated simply because that's pleasurable. There's this an assumption that that dictates like what your orientation
Well,
is, which is not
that's
the case.
that's associated with a group of people, and straight men don't want to be associated doing that type of act.
But it's because there's a particular stigma about it, right? Because then
Right.
it calls into question somebody's quote unquote masculinity, as if
Mhm.
masculinity was a tie to the behaviors that you engage in, right? We as a society kind of look down on or are like abhorred by the kink community that engages in a number of like different fetishes or BDSM, right? We look at those people as quote unquote deviant as a society, right? So like we've come far, but like not like we really haven't come that far when you take into consideration how we as a culture view sex and sexuality. Um it's also just like not talked about enough. Like if we're going to talk about like sex education, right? Like what do you what sex education, even you, like what do you remember from like grade school sex education?
We saw videos of sperm swimming to the egg.
Hmm.
Um, we saw pictures of the male and female anatomy.
Okay.
I mean, that's pretty much it. I mean,
That's it, right?
it's very limited. So yeah.
Very limited. And it also like probably something about STIs and STDs, right? Probably those
Um,
kind of like wild images of genitals that had like warts or herpes, open sores or whatever, right? You might have seen that one too.
yeah,
So our
yeah,
sex education like really focuses on outcomes as a potential negative. Like you do not want to engage in this behavior because you can die from AIDS tomorrow. Obviously, that's the
yeah,
only result that's going to happen. Or you
yeah,
can have a baby and you're too young, and as a result of you having a baby young, your life is over and you're pretty much going to be destitute. We educate our children about sex and sexuality in a way of avoidance and do not do it, right? But what would it look like if we, and this was one of the questions that you had listed there, like would it look like if a part of our sex education to our children included a conversation about pleasure, what pleasure actually looks like, what it means to be in agreement for these particular acts, right? Or behaviors, what it means to have like ownership of your own sexuality. Because we might have talked about, I think we talked about this last time of like the
yeah. I was kind of freaked out about it because as far as you're saying, the kids should be learning about it in school. It's like I don't know. I mean, now imagine I have two daughters, so
yeah,
maybe I feel that way because of them. But if I had sons, I probably wouldn't care. I mean,
which is so
unfortunately,
gnarly to me, which is so gnarly to me. But like, I think we do a lot of this, and it's not even gender roles. It's very much these historical sexual roles dictated by gender, in that boys are supposed to do and be one thing and girls are supposed to do and be the other thing. And
mhm,
then that leads into like gatekeeping stuff, right? Like girls are supposed to be the ones that girls are the only ones that say yes or no, right? That means that a guy or a boy should always be ready for sex. They always want it. And
Yeah,
so the
ego
girl is
thing.
the one
Yeah.
that makes that decision if it's going to happen or not, which is not always the case, right? We know that consent should be going both ways, that both people should be actively, enthusiastically, I like is enthusiastically consenting to these behaviors. The other thing is that the myth that we have is that like no means yes and maybe means yes kind of thing like that, right? Like if she's saying no, she's just being coy, she just wants you to try harder.
You just gotta know her body language and her voice
Even
inflection.
that, right? Because like that leads into, where we are as a rape culture, and especially um when folks get to college. It becomes really really like really dangerous. Like I was one of the stats that I had talked about with my class was that females, women going to college, but so that college age of like 18 to like 21, 24 type stuff,
Yeah.
those women are 3 times more likely than women in the general population to experience a sexual violence.
Okay.
3 times more likely
Three times.
because they're going to college.
You know what? I've seen that, but I heard about some like some counter evidence to that because like the way like the women were like kind of like asked about their sexual like encounters or like experiences, they would be asked like certain leading like questioning doing surveys, and
Mhm.
those questions would lead them to believe that, oh, maybe I was sexually assaulted.
Mm.
So that's why
What
that's why
data said that?
what data said it. Well, I will refer you to this. Well, actually, if I was to send you this video, then it probably would trigger you. It probably would trigger you.
So what do
But
you
yeah,
mean by like a video? Like another podcaster
yeah, it's a podcast in which it's called Fresh and Fit Podcast. They actually
who did
did,
their own research on this, or
yeah,
like,
yeah, they actually did research on it.
hmm, I'm a
Yes.
little bit suspect about it.
Why? Because they have podcasts.
No, no, because, like, research should be done in a way like, research the way the research is done is also systematic, right? Like, just like I can't tell you to, like, rub moon rocks on the heels of your feet to, like, cure your depression. Research also has to have this kind of methodology to indicate, like, you're gonna get good data. So I'd be curious on, like, what their research methodology was. I'm not saying that they're delivering bad data. I'm definitely not saying that, but I'm just curious of what their research methodology was.
And also, I will ask you, like, as far as the research that said that women on campus are 3 times is more to be sexually assaulted from like the general population. Like who
College age, not specifically campus, college
college
age women.
age
Yeah.
women. Okay, all
Mm.
right, okay.
Mhm. And so, like, those numbers are really scary, right? Like, for anybody, I think those numbers would be really, really scary. Just like it sends this message that as a woman going into college is could even be the reason why she gets assaulted, right? Just simply because she's out and about in college. But then also think about these early messages that we share with our children about what boys are supposed to do in terms of sexual activity and what girls' roles are supposed to do. So all
Mhm.
that to say, like, how much how much of a difference could it make if we started at an earlier age to reframe how we've been teaching children about sex and sexuality to include conversations of like what self pleasure is even a thing. I grew up a Catholic and I went to a Catholic school my whole life. And so like if you are Catholic and anybody else who might be listening that's Catholic, the Catholic Church is like masturbation's a sin. Like any sexual act that does not result or could not potentially lead to procreation is a sin. Like don't do it. Right? So if you grow up with those kind of early messages that even self-pleasure is a sin against God and that you can be, damned to hell as a result of that, like what does that person, you know, what are the messages that are sent about what your options are really, right? So
Mhm.
again, what would it look like if we taught our children, not taught how to, but just that this is a thing.
Well, maybe
um
they would tell y'all to like get married early so that way y'all can enjoy those. those
And then
pleasures
I'm sure
all
that
you
also
want.
has contributed to our divorces rate when people are like, "Well, that was fun, and I don't actually like this person at all," because I don't know them and I didn't have the, like, mental kind of capacity to make the, long-term decision of, like, this is the partner that I want for the rest of my life potentially. So I
Well,
just think there's
well,
could
the
be a
divorce
number of.
rates kind of skyrocketed after they kind of changed the landscape of the actual law as far as making no fault divorces,
Mhm,
like in fat, and also what was that? Um like certain reasoning,
mhm,
irreconcilable differences, stuff like that.
mhm.
So yeah,
Yeah,
as far as changing the whole landscape on that, so that's why divorces has skyrocketed, and also include the sexual revolution. So
yeah.
yeah,
But
so yeah,
also,
no, no more,
do
no
you want your
more starting
daughters to
wedding.
get married at 18 just so they can have sex with somebody?
I would like them to get married within like the range. If it was up to me, the range of like 22 out of college up to
Mhm.
28. 22 to 28, I would like for them to get married.
You're like, "That is the window." And
Yes,
so what
that's
happens
one.
if they're, like, 35 and not married?
I will still love them dearly, but
I
but
hope so.
this is my opinion. But I
Yeah,
just hope that they take advantage of. Okay, they'll likely be in college,
okay.
have a college experience. Hopefully, get that stuff out your system so that way once you're out of college, you got
Yeah,
from 22 to 28 to pair with a man, get married, have kids, and then live happily ever after. So
I
that's
see.
the most perfect situation, right?
Okay. Alright. I'm like, "Okay." I'd be curious considering, like, the marriage age of marriage is, like, a lot lower or a lot, later in life now.
I
So maybe with
believe
this new generation, maybe it'll go back to, like, the 20s.
I believe for Black women, it's like 29 or 30 as far as the average age of getting married, right?
Yeah, but as opposed to, like, even, like, 30 years ago when it was, like, 30 or 40 years ago when it was, like you said, like, in college or right out of college.
Mhm.
Even the what is it, the 50s, 60s, I think, where this, this kind of, um, cultural understanding that, like, women go to college for a Mrs. degree, right? Like, you're going to college, but one of your main motivations of going to college was to find your husband, like a Mrs. degree. So that's very much changed. But I do hope your babies get married by 28 so they can continue living out the fantasy that you have for them.
And mind you, I mean, I had kids later in life. My first one, I was 35, and my second one, I was 38. So,
Mm. And
so
how
it
old
was.
were you when you got married?
I was 30. What was that? I was 34.
Okay. And your wife around the same age or a little bit younger or older?
She's 4 years younger than me.
Okay, so she was, like, in her early 30s as well.
Mm-hmm.
Okay. But
Yeah.
even then, you're like, "No, the babies get married between 22 and 28."
I mean, I would drive that point home to him, like, hey, like, this is my recommendation. Y'all
Okay.
should get married between 22 to 28. Take with a grain of salt, but hopefully y'all listen to. I mean, hey, have you ever heard of Kevin Samuels?
Uh-uh.
No. Okay.
Mm.
So, all
What's
right.
the name? Kevin Samuels?
Yeah, Kevin Samuels. Yes.
Mm,
He
mm-mm.
kind of like drives that same point home as well, but he actually kind of caters to like a specific like group of men as far as like representing like the high value man. So
What's a high value man?
his definition of a high value man, you got to make at least $10,000 a month. So over like $100,000 a year, like adjusted for like certain locales. Like, but
Mhm.
he pretty much kind of talking Atlanta or Dallas dollars. So, but if you're in
Okay,
New York, Chicago, LA, hopefully you'll be making over 250, $300,000. So I mean, he kind of represents like the high class, high elite clientele.
okay,
So basically, he just he has his YouTube channel,
okay.
which he's trying to like coach women into like, okay, if you want one of these high value men, then you gotta like kind of like know what they want, and are you what they want? So like
Mm,
you got to be in shape, you got to have a good attitude, you got to be feminine, you got to have domestic skills, stuff like that. So
'kay. 'Kay.
that's all you got to say. Is just
That's
okay.
it. That's it. Just okay. That's good to know. Good to know.
I mean, that's the basic summation I can kind of describe his channel, but yeah, I mean, it's very entertaining. But I'm not
Mhm,
sure if you was to see like a couple episodes on how you would feel about it. But I mean, I
mhm,
think he's very fair. He gives both men and women like equal treatment as far as the way he critiques them. But
mhm,
actually, he went viral because he actually kind of went after this black woman. But prior to him going viral, I mean, he was giving black men the business, but no one really paid him no mind. But
mhm,
far as him just going ham on a black woman, and that's how he went viral on Warsaw hip hop, and then he just been this internet sensation. So
mm.
yeah,
All press is good press type stuff, right?
yeah. I mean, he got over 1 million followers now, so I mean, he's doing pretty well. So
Yeah,
I'm sure he's good. So
yeah.
yeah, but yeah, we reached our hour. I really appreciate it. But
Of
we could probably
course.
touch on some other stuff at like a later date. So, but
Sounds
um,
good.
but yeah, I really appreciate you taking the time out. And but yeah, any parting words for the people out there?
Um, well, since we were talking about like, um sex education, I do encourage, if you are somebody who is raising children, to be an active part in their education related to sexuality, and sex and sexuality, because what they're going to get from the school system is going to be a very kind of narrowed view, and it might not encompass everything that that child needs to know. So be deliberate in how you decide to educate your children about sex, because I think it's important. I think it's really,
Yeah.
really important.
I'm afraid to have those conversations, but I probably have my wife take the lead on that.
Well, they want, especially if your children are going to be, especially if they are attracted to men, they're going to want your input too. It's going to be a collaborative conversation. Again, I'm not saying that anybody needs to go into the details of like the how to, right?
Mhm.
We don't need to go into that level of details, but even just acknowledging that, pleasure is a thing, and everybody in the sexual, everybody in the sexual party should be is deserving of pleasure, and so it's not just focused on one person, but
All right. All right.
everybody should be having a good time and a safe time.
Oh yeah, yeah. I second that. I appreciate it. Yeah, thanks a lot, and happy holidays, Merry Christmas, have a happy New Year, and hopefully everything starts out good for 2022 for you.
Thank you, and thank you for having me again. It's always
Yeah,
fun.
and no problem. I'll be reaching out to you sometime soon, and we can go at it for a part three sometime.
All right.
All right, thank you so much. I appreciate it. You have a good one.
Bye.
All right, bye bye.